where does that list come from? Like, can you just pick anything to give someone and they go to a pharmacy, or like, are you only allowed to sell certain ones, or is there like
I can get you whatever you want. What do you want? What are you asking for?
Yeah,
This is how doctors get in trouble.
Yeah.
What would you like? No, I can prescribe anything. So,
okay.
So I guess
maybe that's another thing in the States. Like basically, you know, when they show like people coming in to like doctors or hospital and trying to sell them to sell their drug, you don't have that. You just get to choose from any drug.
Correct. So,
okay. So this is different.
The United States and Canada are very different when it comes to medicine. So America is financially driven.
Mm-hmm.
So hospitals are for profit. You know, their bills are huge. The medications down there are more expensive than they are in Canada.
Mm-hmm.
You know, they're still expensive here, but yeah. So there is a for-profit system.
Mm-hmm.
In Canada, it's almost the reverse. So in general, in Canada, the thrust is go as cheap as you can.
Mm-hmm.
So, you know, there's groups that will do studies to show that, you know, this medication that's cheaper than the other medication is just as good.
Mm-hmm.
And then encourage physicians to prescribe that. You know, we have, you know, campaigns to prescribe less antibiotics. We have campaigns to, you know, use less medication, which I think is a good thing.
Well, that's cool.
The downside of that system is if there's a really good medication that's new, it's almost never covered. So we have pharmacare. People get different coverage depending on their finances and their means. Pharmacare, quite conservative, doesn't in general cover new medications, or if there's a cheaper alternative, they'll cover that one. So I think in your question was, how do I decide which medication to use?
More so just like how, yeah, no, like that. I was more so asking what you answered. Like how, like what do you have access to, and how, like how do you get the drugs you get to choose from, really? Which I think that's like really, that's different than I thought, because when you watch the movies or you hear about, I mean, I think that's a good piece of information for people, because even me, I had no clue how it worked, and I just assumed it was the same as the States. Like they sell you shit, you make money from it. Whereas now, I think that's useful for like the listeners here, because they go like, oh shit, like they're actually trying to do less of that. And it's like the complete opposite, because most people think that. Like when I talk to people, like, well, they're just making money. They're just making money. Whereas like,
I'm gonna nip that in the bud right now. I do not get paid to write prescriptions.
mm-hmm.
Whether you leave my office with or without a prescription, it does not change a thing.
Mm-hmm.
So my goal in general is people leave my office without a prescription.
Mm-hmm.
The least amount of medication people use, the best it is.
Because the medication doesn't even go through you. No. Like you write that piece of paper, but then it goes from like that. It's like direct to consumer to the person. You're not in it.
Pharmacies would really like you to all be on medication.
yeah.
That's how, that's how they make them. I mean, nothing against pharmacists.
Yeah, I mean, right? They have to make it.
And, you know, a good pharmacist is worth its weight in gold.
Mm-hmm.
I remember one woman coming in and saying to me, she had, I don't know, I think she had like a bronchitis, and I was giving her an antibiotic. And I think it was like, you know, the one I was giving her was a pill twice a day for 10 days.
Mm-hmm.
And she said, you guys get paid for prescriptions, don't you? And I said, ma'am, I don't know anything about that, but here's your 20 prescriptions for one pill each. Yeah, no, we don't get paid to write prescriptions. I don't know where that came from. The other one I hear is, you know, doctors know the cure for cancer. You ever heard
yeah. Well,
like doctors know the cure for cancer. So I'm like, okay, so if you think I know the cure for cancer and I'm not telling people, that would make me like the most despicable human ever. Why would you come see me?
Yeah.
Are you hoping you get on my good side and I tell you the secret?
Yeah.
And then what about the doctors that die of cancer? Is it like, Bob, I'm sorry, but you have to die of cancer. You have to have colon cancer. We got to keep the secret, Bob. I'm sorry.
You got to take one for the team.
You got to take one for the team. We're sorry, man. Your number came up. You know, like I don't know. People get strange ideas. I guess just look at the United States and what's going on with their political climate about strange ideas.
Mm-hmm. So. Yeah, I mean, I think a lot of it is influenced from there, and I think especially a lot of it just comes from, like for me, it comes from movies and stuff. From what's the movie with where Buddy has AIDS? It's a true story. Matthew McConaughey.
Oh yeah, something to do with cowboy. I can't remember the name.
Yeah, I forget, but he's like a cowboy in it. And when he goes into the hospitals in that movie and the doctor's offices, the drug companies are like pitching to the doctors and telling them like, hey, like if you sell our drug or if you sell our drug, we're going to give you all these perks and all these things. And it gives you like it gives you behind the scenes view, but I mean, it doesn't necessarily mean that's true or how it works here. So I think everything that I've seen is mainly movies and things that are actually produced in the US. So like it's about the US system and not necessarily here.
Although, like, just shouldn't let us completely off the hook because there are pharmaceutical reps.
Okay.
So they come. So through the years, like 20 years ago, pharmaceutical reps would take you to play golf.
Yeah.
Or, they'd have dinners where they'd wine and dine you. And the regulations have become much more strict because, people say that potentially that's a conflict of interest if some drug rep is giving me free stuff. I don't see the problem. If I get lots of free stuff, clearly it's a conflict of interest.
Yeah.
So it's very, very regulated now. So they can't even give you a pen.
But what are they trying to sell you on anyways?
So they would have, because within a class of medications, there might be 5. Let's take depression. Just to say there's 5 really good SSRIs, which are, serotonin reuptake inhibitors. They're a class of medications that work well for anxiety and depression. Say there's 5 of them and they're all pretty equivalent. The pharmaceutical rep wants you to choose theirs. So they're going to come in and give you a presentation of why theirs is better. But I don't think you can really use their information at face value because they're not going to tell you the truth that they don't want you to hear. I mean, they'll tell you the truth. They're not allowed to lie to you about studies of why this did this or that did that. But they're not going to tell you, but drug C, our competitor, actually did this study where they showed they were better in this area. They're not going to. Well, they wouldn't be a very good rep if they told you that.
Yeah,
right.
At least to their company.
So you have to take that with a grain of salt. So in general, I don't see drug reps. In general, I just don't.
So because they're not like that, still doesn't give you a commission on their sale though. Nope. They're just asking you to promote it so they get the sale through the pharmacies.
Yes. So a pharmaceutical rep, if their sales for their drug increase in their area, I think they're going to get rewarded financially for that.
Yeah, they will. Yeah.
Right. So no, in their defense, again, what if their drug is the best? Right. And they're just trying to spread the word that, hey, listen, our drug is the best. Maybe it wasn't the first on the market, but it's the best. So, you should consider it. And, I think what most physicians do is you're not going to use all 5.
Yeah.
So you're going to decide, hopefully based a little bit on science and experience, which 1 or 2 you're most comfortable with and have those are your go-tos. So if someone fits the criteria of depression that you think needs treatment, your first choice is usually this. If this one doesn't work out, your second choice is usually this, and you have reasons why you do that. And that would be the same for diabetes. It'd be the same for, heart failure, high blood pressure. You try to, you can't get familiar with every drug.
No.
Right? You kind of want to choose and know a fair bit about the ones that you're prescribing.